Hi, I'm Abby Wentz, and I am going to be doing a respiratory assessment today. Hi, nice to meet you. I'm going to do some hand hygiene. What is your name and date of birth, and where are you and why?
Michaela Kemp. My date of birth is March 13, 2002, and I'm at the hospital for a respiratory assessment.
Okay, so first we're going to look at her general appearance, which she's calm, she's alert and oriented times 4. She isn't like frantic or anything like that, so her general appearance is good. She's breathing, she's not blue. Her posture is good, she's sitting up on her own, so her muscles are working like they should. Her breathing effort seems to be normal. She's not having any trouble and it's not labored. Her skin color looks normal. She is not pale, but she's white and everything looks the same. So now I'm going to inspect the chest. It looks symmetric on both sides. It's rising on both sides, so rising bilaterally. I don't see any bumps or lesions. So her muscles look fine. They look symmetrical and normal. So now I'm going to check her ratio of her AP diameter and her transverse diameter. So it's about 1 to 2, and that's within normal limits. Now I'm going to check her costal angle. Okay, and it's around 90 degrees, and that's also within normal limits. Okay, so now I'm inspecting her nails. She has nail polish, so I can't see her nail beds, but everything else looks normal. Her lips look normal. They're light pink and no cyanosis on her fingers either. Now I'm going to check her respirations, so I'm going to count them for 30 seconds and then times that by 2. Okay, I got 10, so her respirations per minute is 20. It looked equal and bilateral. Her chest expansion is also symmetrical, and it's rising on both sides at the same time. Now I'm just going to check her trachea placement. Sorry, my hands are going. And her trachea is midline. Now I'm going to palpate the front and back for tenderness, bulges, symmetry, and things like that. So it's symmetrical on both sides. Sorry. No bulges or anything like that. Do you have any tenderness where I'm touching you?
No.
Okay. So there was no tenderness on the front or back, no bulges, and the symmetry was good. Now I'm going to check her thoracic expansion. So I'm going to have you stand up. And then I'm just going to have you take a few breaths, normal breaths for me. Okay, and her expansion is normal and symmetrical. Okay, first what I'm going to do is I'm going to take my stethoscope and I'm going to listen to the front. And first I'm going to be listening for vestibular breath sounds. And these should be low-pitched and clear. Okay, they were clear and low pitched, so that's within normal limits. Now I'm going to listen to the bronchovestibular, and they should be higher pitched and also clear. Okay, those sound normal and high pitched, so that's within normal limits. Okay, now I'm going to listen to the bronchial, and they are mid pitched and clear. Okay, they all sound good and within normal limits. Now I'm going to listen to the same 3 different sections just on the back. Okay, just take no more breaths for me. The vestibular sounds good. Bronchodvestibular sound good. Okay, and then the bronchial sound good. And they were all clear and the right pitches.